This case was presented in our clinic post-orthodontic treatment. The diagnosis was gingival hypertrophy in combination with altered active eruption. Although we explained to the patient that in order to fully expose the crowns of the teeth, we will need to do gingivectomy in combination with ostectomy and osteoplasty, the patient declined from having an osseosurgery. So we decided to proceed with just the gingivectomy and the gingivoplasty. And for this reason, we utilized a laser. In this case, we utilized an NdYAG laser with a setup of 4 watts. The laser gives us some certain advantages, such as better control, especially during the gingivoplasty, and also much less bleeding throughout the operation. Some patients also report less discomfort and faster healing process when we utilize a laser compared to utilizing a scalpel. As you can see, we try to avoid lasing the tooth surface. We try to stay parallel to the long axis of the tooth, and we are very thorough in removing the epithelium from the papilla and festooning the papilla. As we know, the papilla height is dependent on the interproximal bone height, so as long as the bone is there, the papilla will grow to the proper dimensions. Utilizing the laser makes the procedure taking more time compared on using a scalpel. So you need to be patient. As you can see, we also de-epithelialize around the border of our free gingival margin, and this will allow better tissue adaptation throughout the post-operative healing period. While we are doing the procedure, we wet the teeth and the tissue, keeping them moistured, utilizing a wet gauze. So utilizing this technique, we were able to do gingivectomy and gingivoplasty from the first premolar to the first premolar of the lower anterior teeth. At the end, we evaluate the tooth length. We cannot expose more because since we are not doing ostectomy, the tissue will grow back. So we stopped at the level that we have appropriate biologic width. At that time point, we also performed a minor frenectomy. And we do that to protect the free gingival margin of the lower central incisors from future recession that can develop from pulling of the muscle fibers upon masticatory functions. Here you can see that 3 weeks later we have a very nice result. Thank you for watching.